everyone, and welcome back to the Lube Tube. My name is Jeanette, and this is my co-host, Brittany.
Hey guys, we're back.
We're back. It's 2025, y'all.
Oh my gosh.
I know. Happy New Year, Brittany.
Happy New Year. New Year.
Same us. not much has changed. And I think that's a good thing, right?
Right. I mean,
I don't know. We like to think so.
Yeah. It's literally been, 13 days? So we still have time.
We still have time to change things that maybe we should think about changing. But I'm not sure what those are. I'll figure it out. Anyways, I'm excited about this one because we're talking about something that a lot of people have messaged us about to kind of touch this topic. And after Brittany and I started to sit down and kind of talk about this topic, we realized how big this topic can be, right? And this is supplements, right? And the title of this one is called Supplement Sis, and it's the secret sauce to women's wellness. So there's a lot of supplements out there. And, honestly, anybody can sell you anything. And a lot of these supplements are not FDA regulated, so they can really be anything in those bottles. So I think my goal of this talk is basically to talk about which ones that our body, especially as females, need, and which ones that we really don't need that maybe be more of a gimmick.
Right. And yes, that's a great plan. And I think why this topic has become such a hot topic is because you can get on social media and find about 100 supplements that you should be taking. Or you can turn on the TV and see, I mean, it's actually, I feel like it's almost gotten worse than pharmaceuticals. Like they're at the level of pharmaceuticals.
Absolutely.
Remember where we used to see you still see advertisements for certain drugs. I mean, I feel like supplements have reached that level.
Yeah, I can't tell you how many times I'm like aimlessly swiping on my phone and how many supplements. And I'm sure it's because it obviously picks up a lot of what you and I are doing through the Lube Tube, through our social media, but how many supplements there are that they're trying to sell me for perimenopause and menopause that come up that I'm like, oh my gosh. And if I didn't know about this stuff that we're going to talk about, I would honestly think, oh man, maybe I do need this, right? It's telling me that it's going to fix all the things with one magic pill. Maybe I do need these. But honestly, if we could just stick to the main ones, I think that for the most part, you're pretty well taken care of when it comes to supplements. So I'm going to hit on all of the ones that I think are obviously most important. And then I have a few other ones that I'm going to touch for basically disease or symptom specific medications or supplements. So I think it's important that we kind of throw a little disclaimer out there, right? Like just because you and I say that, hey, these are great supplements, they're not perfect for everyone, right? And if you have certain conditions like liver issues or maybe even kidney issues, I think it's important that we also say, hey, probably should consult with your provider before you start these over-the-counter supplements. Before you just throw them into your regimen, I think it's important that you talk to somebody that knows your history and is able to make that decision for you. So why do these supplements matter, right? Well, because the American diet sucks, right? And for the most part, us as females are not getting everything we need in our diet, right? We're not getting all the vitamins and support that we need for bone health, heart health, brain health, just through our normal diet. And sadly, but I mean, this is true. I mean, life's busy. I know me personally, I'm going to work full time and then raising two boys. You work two different jobs. You bounce back and forth between all kinds of things that you're doing after work. And so trying to plan out 3 fully balanced meals with all the vitamins that are needed, it's nearly impossible in American diet. Am I wrong?
100%. And I mean, it's nearly impossible in any diet, right? There's always going to be something that we're lacking. No matter where you're living, but the American diet specifically, yes, we are, damn, we suck.
Lacking.
No, we suck. Let's just put it out there. We suck. Yeah.
Oh my gosh. And at different stages of your life, you're going to need different vitamins, right? These aren't just like a one-all, right? Like one vitamin is not going to cure it all. Like, I know there's a lot of multivitamins out there, and I'm not trying to say that all multivitamins suck, but for the most part, one multivitamin is not going to get you everything you need as a female. So I think it's important that we touch a little bit on the certain ones that are obviously really important and ones that are important for different stages of our life. So the first one I think we should talk about is honestly the big gun, the one I think is the most important, and that's going to be vitamin D, right? Vitamin D is so important in not just our immunity. I know when COVID came out, right, everybody was like, up your vitamin D, up your vitamin D. And that was huge because to be honest with you, when I check a vitamin D level, most women are not in optimal range. I know in some women, way less than optimal. And my optimal range for if you were to come and see me, as I want to see your vitamin D at least at a 50. Okay. 50 to 80 is kind of like the money spot. And most women, it's not there. And yes, it's wonderful for immune support. And I think there were so many studies that were out during that COVID time where it showed that it could actually be a preventative measure. And in some situations, they were using it in the treatment of COVID-19. But it's not only used for the immune system, but also bone health, right? So as we age, we tend to lose the density of those bones. And what that means density-wise is if you were think about a honeycomb, the honeycomb is really, really tight, right? All of those little areas that the bees have made has been really, really tight. But as we age, those little spots get further and further and further apart, and they create more of a brittle bone, right? And so something that's going to be easily broken if we were to fall. That's why as we get older, the risk of fracture is higher for women, especially postmenopausally, because they have now become osteopenic. Well, the treatment and prevention of osteopenia, which is the breakdown of that bone or the breakdown of that honeycomb, is vitamin D support, right? Because vitamin D is what helps kind of rebuild that bone. So bone health is going to be honestly another topic that you and I are about to do. And I think that's also going to be really, really important. But to support that, we really, really need that vitamin D to be at least optimal range.
Right. And there are, I know I have patients that come in and say, well, I'm getting lots of sun exposure and I feel like that's sufficient. And for some people, I mean, maybe they are really getting that. They wake up in the morning, that's the first thing they do. And a lot of people, that's the first thing they do is they want to walk outside and feel the sun.
Yes. What is that called? Like grounding?
Maybe.
Yeah, I should start that.
Honestly, if you go outside and put your feet in some fresh, dewy grass, it's real nice. I'm just going
to go out there in my robe and stand in the middle of my yard and see what my neighbors think every morning.
Yes,
maybe not now. It's freaking cold out there.
Yeah. I mean, there's certainly, I just want people to know, yes, can you increase your vitamin D level with sunlight exposure? Absolutely. But are most people getting the correct amount of exposure to get to levels that help with the honeycomb?
The answer is no.
Thank you.
Yes. And honestly, you have to have the vitamin D there in the bucket for it to be metabolized by the sun. So if your bucket's not full, the sun's not going to do squat for you, right? So you actually have to have that vitamin D elevated there in order for it to be metabolized by the sun. So the sun's great and all, but you got to have it there for it to do its job.
Diddly squat is what we say.
Diddly squats. That's my new exercise routine. Diddly squats.
Oh, good. Wow.
New Year, same me.
So when we're talking about dosage though, for the vitamin D,
yeah,
ideally, what are you telling your patients that they need?
Well, I mean, if you look on the back of a normal vitamin D bottle, or in a multivitamin, it's only going to have about 600 to 800 international units. But most women need about 5,000, anywhere between 2 to 5,000. I have some ladies that need 10,000 IUs daily. So my favorite is one that's going to contain K2. Okay. So K2, vitamin D plus K2 is where it's at, right? Because the K2, think of it as the little chaperone that gets the vitamin D to that storage. And so it's important to have at least 2,000 at least, but most women, it's about 5,000 IUs a day.
Nice.
Another really big, important vitamin that I think, honestly, most women should be on is omega-3s. And omega-3s, like vitamin D, have so many benefits to us as females. They're going to help with our brain. They're going to help with our heart. They're going to really be overall anti-inflammatories for the body. And omega-3s, if you think about it, they're usually your fish oils, right? And a lot of women can get their omega-3s through diet if you're eating the fish that is high in omega-3s, but you have to make sure you're eating fish that's high in omega-3s, right? The other important thing is a lot of women will not take omega-3s because they don't want to take fish oil because it tastes like fish oil. And I agree, absolutely disgusting, right? Like who wants fish burps?
That nobody. But I feel like I can't remember the brand right now, but I know I've heard of a brand that they have been able to create some sort of recipe, if you will, that does not have that issue where you burp and it's like, oh, I just had some salmon.
Oh, with my coffee. That's so gross.
Oh my God, that is offensive. I know.
I know. This is why most people stop omega-3s is because it's offensive, right?
Yeah.
And you're sitting there, you just finished your nice cup of coffee, and now an hour later, you're burping up coffee with fish. That's disgusting, right? But you're right. There are burp.
You're really selling this supplement.
Sorry.
Jesus. Hey, do you want some fish with your coffee? Sure, take omega-3s. Your brain will be really sharp, but you will smell like fish.
It's true. It's gross. But what I was getting to is there are, just like you said, some brands that do not do that, right? And one of them is actually a prescription that is one of my favorites. There is a prescription out there, and it used to be where you could not everybody could get this covered unless they had a ridiculously high triglyceride level. But now it's recently been approved to help people just to lower that triglyceride level, but also for an overall inflammation. And that medication is called Vascepa, VASCEPA, Vascepa. And it is a really good EPA DHA. And these are two things that you want to have in your omega-3s. The dose of that is like insane. It's like 4 a day. But honestly, you don't need 4 a day if we're doing it just to help with overall inflammation and reducing that brain and heart health risk. But I think that you're right. There is one that's made by Mega Red, and it's a krill oil. And Mega Red does have a burp-free option, and I do recommend that.
Burp-free.
Yeah.
So just a few tips on the labels. We're looking for the I guess the acronyms EPA and DHA, and preferably you want to see something that says burp-free.
Yes.
Okay, great. I'm glad. I think we've covered omega-3s. So,
okay.
Moving on. Well, let's move on. Let's move on to fiber. Fiber.
Oh, yes. And fiber is one of those things that you might get enough in your diet, right? Like if you're a big fiber eater, so say you're eating oatmeal for breakfast, or you're having a really good cereal, or maybe even a protein bar, or maybe you are having a smoothie and you're putting extra greens in your smoothie, you might be getting plenty of fiber, especially if you're having at lunch, having a really big salad or something that contains a lot of fiber. You might be getting plenty, but most women are not getting enough fiber. And as we age, we worry about, like we talked about before, is insulin resistance, right? We worry about weight gain, and we worry about our gut slowing down, because I know we've talked about this before, but estrogen is literally has basically a spot in every single part of our systems, our GI system, our cardiovascular system. All of those areas have receptor sites for estrogen. And as our estrogen starts to deplete, everything tends to change up a little bit. Well, insert the GI system. So a lot of women will experience during perimenopause maybe more constipation than they've ever had before. And on top of that, our endocrine system is slowing down. So there's the thyroid that's not working as well as it can. And then boom, now you're experiencing more constipation because your thyroid is not working as good as it can. So in this situation, fiber can sometimes be very, very beneficial. And, it helps not only in the digestive health, but also controlling that insulin resistance and bringing down that blood sugar. But fiber has also been proven to help with heart health, right? So these three main things that you're going to get out of just adding more fiber to your diet can be very, very beneficial for you in the long run. And there's a couple of different ways you can get that is kind of over the counter. I know in the past when I was drinking a smoothie in the morning, I was adding more. I know you're laughing, but I used to do this.
I know. No, I'm curious why you stopped.
Because I just got tired of it. Like I'm one of those people that I can do something for a very, very long time and then it works really, really great. And then I'm like, okay, I'm tired of that. Let's try something different. Right. And so now it's like, I want to think about making a smoothie, which I felt really great when I used to do that. But in that I would add flaxseed, and that flaxseed was super, super beneficial because it was high fiber. Right. And then the protein powder that I used had a lot of fiber in it too. But you can also add in just over the counter, like FiberCon or Benefiber, in order to get that. But what you want is a water soluble fiber, right? You want one that is actually going to be able to move through the gut in order to help you rather than just staying hard and stuck in the gut, right? So you want it something to be soluble in the water.
Right. And so you're typically aiming for what, 25 to 30 grams typically is what you want to aim for?
Yeah, I think that's totally sufficient if we're not dealing with somebody who deals with like a chronic constipation that we're fixing something. But if it's something to just to keep the gut moving, but also to prevent all these other things that I just previously mentioned, I think that's a great enough dose for that.
You just mentioned something that actually reminded me of a question I get frequently. With vitamins, this is the question I'm posing. Do I have to take my supplements with food? Do I have to take them without food? And I'll tell you how I usually answer it. I mean, there's science behind it. You just mentioned water soluble vitamins. There's also, or supplements, I should say, there's also fat soluble as well.
Mm-hmm.
And I know with the fat soluble ones, you 100% want to take those with food because in order for them to do their job, there has to be fat present.
Right.
Correct. So historically, I've always told my patients, if you can take it with food, I would recommend it. And definitely if they're taking, an A, a D, a K, we're going to do that with food to avoid stomach upset as well. Obviously. Right. But I think it's always a good rule of thumb. Like if you aren't 100% sure, like, what am I taking? What am I doing? Mm-hmm. Then take it with food.
I agree. And honestly, most of the time, if you take a vitamin on an empty stomach, it just doesn't sit very well in the stomach anyways. So Brittany, make a great point about fat soluble vitamins because there's most of the vitamins that we recommend for women are going to be fat soluble. So that means they are going to require some sort of food or fat in the food in order for it to actually be used and used appropriately in the body. So yeah, great point.
Thank you. Ooh, the next one.
Yes.
God, all over the socials.
All over.
And
you know what? I'm a huge fan. Okay. I am a huge fan.
No, I don't hate it. I don't hate it either. But I'm just saying, I think that this is one that a lot of people have asked us about, like, oh, which one do you recommend? And it's like, there are so many options.
Yeah, there are a lot of options. And to be honest with you, what we're talking about is collagen, right? A collagen that also contains hyaluronic acid, right? Collagen is one of those supplements that it is good for us as females because it helps with so many things, right? It helps with our skin, our hair, and our nails. It helps with all the pretty stuff, right? All the stuff that we're always wanting to look better. But at the end of the day, it also is huge as an anti-inflammatory and also huge to help with our joints and our bones and making us actually not hurt while we're looking pretty, right? So that's obviously very, very important. The thing I like about collagen is that it comes in all different forms, right? You can get collagen in a powder, you can get collagen in a liquid, and you can get collagen, probably in a pill, a gummy. They probably make it in all kinds of ways. Me personally, I tend to do all of my collagen in a powder form. And my specific one that I use is going to be one that contains Verisol collagen, right? And you want to make sure that you have the right type of collagen because it has to be types 1, 2, and 3, which are most relevant to us as females, right? And that specific one that I like is something called Sparkle. Okay. You can get it on Amazon. We'll put a link to it. There might already be one on our website. But there is a flavored one and an unflavored one. I tend to go with the unflavored one because I put it in my coffee every morning. I stir it in and it's completely tasteless. And what I like about that is it's going to promote that skin elasticity, right? It's going to promote that nail and hair growth. It's also going to help that joint pain that we might start experiencing during that perimenopause, menopause time. But it also helps with that skin hydration. Okay. So when you add this with the hyaluronic acid, it creates this synergistic benefit where you're going to get all of that combined into one, right? So you're going to get all the great stuff that we can personally see, like our hair's getting longer, our skin looks smoother, our nails are, looking stronger, but we're also from the inside feeling better, right? It's because it's an anti-inflammatory effect.
So you're sparkling.
I love the sparkle. It's my favorite.
Yes.
It's actually recommended by another person that I absolutely think hung the moon when it comes to treating females and menopause, and it's Dr. Mary Claire Haver. That is her go-to, is the sparkle. She sells her own collagen on her website, but when I compared the two, there was no difference. So I tend to just stick to the one that I found on Amazon because I've been using it over a year and it's worked just fine.
Okay. Well, thank you, Jeanette.
You're welcome. These can get really expensive, but they don't have to be. Okay. Like you just said, it's all over Facebook, Instagram, everything. And people will try to sell you these at ungodly amounts of money. It doesn't have to be expensive. It doesn't have to be something crazy. I think I pay about $30 a month for Verisol. So maybe even less than that. It's $1 a day and it helps quite a bit with that I see as far as benefits go.
Okay.
Another one that I think is also important is magnesium glycinate. And specifically glycinate. Okay, so if you were to go down the supplement aisle, you are going to see a crap ton of magnesium supplements, right? There's magnesium glycinate, right? There's magnesium citrate. There's magnesium oxide. There's all kinds of magnesiums. And so, but the one that I recommend for females is actually the glycinate form. And I recommend this one is because it's easy on the stomach, right? If you go and take magnesium citrate,
oh, well, Jesus, we don't want to do that.
Girl, you will have explosive diarrhea. So please don't do that.
Oh man, that's just for our loyal listeners. Mag citrate is one of the things that they can use for people when they're about to have a colonoscopy. So
that's right. Don't go after that.
Yeah.
Don't grab the wrong one.
Yes. Glycinate is definitely better than citrate.
And a lot of times we use magnesium to help with muscle aches, maybe spasms, to help us sleep at night. It can help tremendously well to help you get some good restful sleep if you're not having some good sleep lately.
Right.
But specifically the glycinate can help you. And the last thing you want to wake up with is at 2 a.m. with roaring diarrhea because you took the wrong magnesium.
And this also, though, this is a supplement that you typically would want to take before bed.
Oh, 100%, because it can have that drowsy side effect. So
yeah,
magnesium is not something that I recommend as an AM dose. I always recommend as a PM dose because you're going to get the benefits of the sleep, but also going to get the benefits of that restoring those muscles and kind of helping with that any type of pain. The dose normally on this one is going to be anywhere between 200 to 400 milligrams a night. And you want to take it about 30 minutes prior to going to sleep or falling asleep. This is one of Brittany's favorites. She takes this one, turmeric, or however you want to say it. But it is also used specifically for anti-inflammation or anti-inflammatory. It also has been proven to help with your brain function. And so I do like that aspect of it. But what I like most about this is because it is a gentle thing, right? You can take it and not even know you really took it. And also it does have some really long lasting effects, but what it does in the body as far as bringing down that inflammatory cascade is huge. It's best to pair it with black pepper, not literally sprinkling black pepper on it, but they do make one that has black pepper extract in it. And that is going to actually help with the absorption of that turmeric.
Yes. And I do love this. I've taken it forever. This actually goes back to my pharma days. I had a doctor who I really respected. He always told me things. It was plain and simple, and it was easy. And one day he came to me and he said, "You need to be taking turmeric." And I said, "What the heck is that?" And he went on to tell me the story, which I've actually fact checked this, and there is some truth to it about this village in India. And in fact, I looked it up before we did this, and if I could pronounce it, I would, but I can't. So this particular village has an incredibly low incidence of cancer, and their main, I don't know if crop is the right word, but what they do, what this particular village does is they do turmeric or curcumin. That is, they put it in all of their food. They put it on their skin. They do all the things involve this. And so there are a lot of things to be said about there possibly being anti-cancer type things, benefits to this. Hasn't been like all of these like immense amount of studies to where I can say this with 100% certainty, but there have certainly been, there's been some evidence that it could contribute to that. So beyond what everything Jeanette said, my doctor from 10 years ago that I called on for pharmaceuticals said a lot of good things about turmeric. And honestly, I mean, I've definitely felt like it has helped me I've continued to take it. And just one thing, don't leave it in your scrubs and throw it in the washer, because then your scrubs will be ruined. Because that's one thing about turmeric is it turns everything orange. So
it's used as a dye. So
exactly. So make sure you take your vitamins and don't leave them in your pocket.
Oh yeah, I'm bad about that.
I know, me too. Me too.
Because I want to take them with food. So I take them with lunch, and then I forget to take them at lunch. And then I get home and I throw them in the wash, and well, there you go.
Hate it.
So this next vitamin is the B vitamin class, right? The B vitamin class are going to be known for their energy and their mood regulation. And then also they're used to make red blood cells, right? So the main ones, because there's a lot of B vitamins, but the main ones you need to focus on are going to be the B12, the B6, and the folic acid, the folate, right? The B12, think of that as like your energy vitamin. You're going to think about that as going to be the one that makes red blood cells. You're going to think about the folic acid as the one that can help with the neuro system. It's going to also be very, very helpful with energy levels, hair, skin, nails. But there's different ways to get B vitamins. And the most common way that I recommend a B vitamin is actually a sublingual B vitamin. So a drop or a dissolvable tablet, because there are some people that have a specific type of anemia where they cannot break down B vitamins, okay? And they're missing something called intrinsic factor. And intrinsic factor is what breaks down those B vitamins. And if we don't have that specific factor in our gut, we are actually not going to absorb B vitamins. And so actually, those patients, not only do they need sublingual, but a lot of times I have to actually move to more of an injectable, right? So a B12 shot that you would get usually once every other week, sometimes once a month, depending on the patient. But I would absolutely recommend any form. You could do a super B complex as well, which is going to have more than the B6, B12s, but absolutely recommend something that at least has those three in it.
Yeah, and there are some people that like to get B12 shots.
Yeah, absolutely.
That's also another way to supplement. But again, you can get that just from pill form as well.
Right. Absolutely. And that's usually my energy vitamin. So say somebody comes to me and they're just like dog tired all the time, and we've kind of really looked into everything else. That is one vitamin that I'm like, hey, you probably should consider adding this on, because most likely you're not in optimal range. And optimal range on a B12 is anywhere between 600 to 900. And most women that I check are suboptimal. So adding on that B12 can be very, very helpful. And I feel that when I do take my B12, I do feel better. But I have to make sure that I'm taking that in the morning, because if I take B12 at night or like a super B complex, it can amp me up to the point where I can't fall asleep at night.
Liddy. You're Liddy.
Mm-hmm. I get lit. Liddy? Liddy titty?
You heard it here. Yep. That's
okay.
Right.
I'm ready. Ready for it.
Okay. So our next one, probiotics. I get so many questions about probiotics. And I think the biggest question that I get is, which one do I take?
Oh my God, there's so many.
Like so this one had this many strains and this one has this many strains. Mm-hmm. And I mean, I know there are certain probiotics that have annihilated my stomach.
For sure.
And then there's other ones.
Can.
Yeah, and they can. And then there's other ones where I've been like, okay, like I know things are working, but I'm not miserable.
Right.
So,
oh yeah, they can tear you up with some serious bubble guts, right?
Mhm.
Like, and probiotics, there's a lot of really great studies out there that talk about the importance of these and multiple things, not just the gut, right? But also helping with immunity. And so I do think they have a huge importance. But you're right. You have to find the one that does not tear your stomach up. A couple of the ones that I wrote down that I like to recommend are Culturel, which is an easily attainable over-the-counter probiotic that is easily to get at any local drugstore. But BioT makes a really good one too called Belly Buddies. And this is one that I know both you and I commonly recommend. It's a gentle probiotic, so it's not going to usually tear your stomach up. I do like that one, and I do recommend that on the daily. And then another one that I recommend, and I know we've talked about this before, is a company called Bonafide has one that called Claire V. And this probiotic is specifically formulated for the vaginal flora. So if you're having recurrent vaginal symptoms like vaginal odor or vaginal discharge, or maybe you've been diagnosed with bacterial vaginosis and yeast multiple times and you are over it, Claire V is a really good option because it's weird about this one. You take it 2 weeks every month for 6 months. So 2 weeks out of the month, you start it again 2 weeks out of the month, and you do that every month for 6 months. And there's I think it's like 86% reduction in recurrent vaginal symptoms. So that's a pretty good reduction. And so I do recommend that one on the daily too. So it really kind of comes down to what we're treating with probiotics, right? Are we treating a chronic diarrhea because it can fix that? Or are we treating a chronic constipation because it can fix that, right? So it really kind of depends on what we're treating and which one we would use in each situation. It also can be used to prevent the bloating, right?
Yep.
So say a lot of women, and which I get this a lot, perimenopause, menopause females, they're just bloated, right? And they just feel so uncomfortable. A lot of times I'll recommend a probiotic just because it can help not just like the GI system as far as moving it along, but it also can help just kind of get that bloat out. So I do think that's kind of an important thing to use to help treat that.
Definitely.
The last one that I wanted to chat with you that I had listed here is calcium. You know, calcium is one of those things that I actually don't recommend on the daily. I actually say if you're getting calcium in your diet, right, which is going to be found in your meats and your cheeses and your dairies, you don't need to take extra calcium a lot of times, right? And even in the density, right? Like we're talking about bone density again, like osteopenia, osteoporosis. And those women, I usually recommend if they're not getting it to definitely take an additional calcium. But for most women, honestly, you're probably getting it from your diet. And the importance of calcium is that when paired with vitamin D, it actually absorbs better and it can actually get to the bone like it's supposed to. But the downside of calcium is it can constipate you, right? And it can also, if you are a person that tends to get more like kidney stones, it can actually cause more kidney stones because the most common type of kidney stone is actually something called a calcium oxalate stone. And those are actually from the ingestion of extra calcium.
Kidney stones. Oh my gosh. Have you ever had one?
No, but I have treated so many patients with them and I feel terrible when I see a patient with kidney stones.
Right. It's one of those things that they say is the pain's worse than childbirth or comparable to childbirth.
Yep.
No, thank you.
I know. And these patients, and you know, honestly, no pain med in the world actually works for them. The best thing that works, and I know you know this, is honestly just IV Toradol, which is an anti-inflammatory. And that IV Toradol with a bag of fluids can go so far, right? But man, outpatient, you can't just give them IV Toradol. Like they feel terrible.
I literally had a patient today ask me for IV Toradol.
Was she in pain?
She had no kidney stones.
Oh my God.
It was just for funsies. You know?
She just wanted some Toradol. Yeah. Can I get some of that?
but via IV, I just don't get it. I was very confused.
You're like, well, where are you going to get the IV? And why do you not have access? Then no.
It's very odd.
Oh my God.
So,
really funny.
So just like a quick overview. So, we know that everyone has some big pill boxes, right?
Yeah.
And we have our medications, we have our supplements. So we kind of tried to narrow it down to supplements that we think can benefit a majority of our listeners. Absolutely. And I think just like going through a quick list of what we went over would probably be helpful.
Yeah, absolutely. So you're going to have your vitamin D, right? That's going to be important.
Then we have our omega-3s.
Omega-3s without the burps.
Gross.
Right? And then fiber and collagen.
Yes. And then we have our magnesium, but the right one. Get the right one.
Glycinate.
And then we have one of my personal favorites, the turmeric.
Yes, the turmeric. And then the B vitamins.
And then we have our probiotics. And then lastly, calcium, but not too much, please.
Yeah. And honestly, calcium, like I said, most of the time, if you are a dairy eater, then you're probably getting plenty of calcium and you don't really necessarily have to add that back in.
And it's also important for us to note that, yes, we're saying you can use these supplements, but this doesn't replace trying to always have a nutrient-dense diet, right? There are so many things that you can get from like whole foods, not literally like the store whole foods too, but I'm saying actually like whole foods. You can see my hands, but they cannot. Whole. That can really help like reach certain levels that you need to, or that are needed for good brain function, good joint health, anti-inflammatory type things, hormone regulation, immunity, so forth. So we also recommend finding these things through a diet as well.
Please.
Jeanette, speaking of, not really speaking of, but I know that it's been the holidays and there's been a lot of things that both you and I have run across or people have asked us questions about. Is there anything that you would like to bring up to me?
Oh, I got all kinds of really great things that I wanted to talk to you during the podcast.
Okay.
I need to tell y'all a story about Brittany. So just a couple of days ago, we had this really important meeting with this really sweet lady. And I'm not going to mention her name, but it was a Zoom call, right? And in true Brittany fashion, Brittany shows up late for the Zoom call. And she's like,
first
hey,
of all,
guys.
I was 1 minute late. And I was 1 minute late.
Fashionably.
And I had just worked out. I know. I'm so sorry. Mind
you, we have never met this lady, right? And she is really hopeful, and we're hopeful that we can collaborate to create something great for women of San Antonio, right? And Brittany gets on. I'm like, hey, girl. And the lady's like, hi, Brittany. It's so nice to meet you. And we're having this great conversation. And Brittany said, hang on just a second. And I was like, what is she doing? And you can see her getting off of her desk or getting up from her desk and walking over. And she's like, my dog just puked all over the carpet.
Okay, first of all, I want to say that I apologized and said, I am so sorry, but my dog just threw up and I need to pick it up. And it was, I now realize it was not the best look, but I also realized that the sweet, sweet woman we were talking to was very understanding. And after I came back, all was well. But yeah, it was not a good first impression. And I hope she realizes I'm much better than that.
But Brittany, how funny was it when your other dog then jumped in your lap and licked your face, and her face was like, "Oh God, is that the same dog that just threw up?" And you go, different dog.
That's funny. I forgot about that part. Yikes! When I asked you for your story, I didn't think this was going to be the first one you said. Thank you. And oh my,
you're welcome. You're welcome. Being
also,
your best friend is one of the joys of my life.
I do want to say though, I was I was drinking an orange drink at the time.
Yes.
And I feel like I should have explained to her that I wasn't drinking like orange soda. That was my collagen. Just saying. That was my collagen. Okay.
Oh, okay.
Thank you.
You're welcome.
There was something else that you also wanted to talk about.
So I shared the other day on Instagram that I wanted to talk to you about this. But the new thing, are you ready for this? People are getting filler in their labia. So in their vagina lips, they're going in and getting basically filler placed, and it's called labia puffing.
What?
Yeah, seriously. So the same stuff that we're injecting into your lips and your face to give volume, girls are now going and getting this done in their lips, but not the lips on their face, but in their labia.
Hold on. Are these like postmenopausal women, or is this like
a combo?
Combo loco?
Combo loco.
What? First of all, anytime I think of needles near my vagina, it's not the most exciting feeling. No. Second of all, there has not been enough of this done by the provider that's doing it for you. I can say that.
I know. Like when I heard that, like I've never thought of taking a cannula of filler and placing it in your labia. I mean, obviously I do O shots on patients all day, but that's obviously different. For something totally different. But this is it's like a big thing. It's now all over my social media, obviously, because I looked it up, which I never should have done.
Okay, but also we all know that at times filler can migrate.
Oh,
so what happens with the migration?
Yeah. And so that's another thing that when I was reading about it, it said that it can also pose a huge health threat because you can get a thromboembolism in the labia. So obviously you can block the arterial or the vein supply, and then you get the area to die.
And then you get a blue waffle.
And then brought it back up.
Well, I'm just saying, like, and then your vagina's dead. I don't like this. I'm not. Okay. This is not sounding good to me.
Okay, I was just going to ask you if you thought you would ever do it, but I guess that's a no.
At this point in my life, no, that's not.
Okay, whenever you go through menopause in 20-ish years, because I think you're so young, right? I'm going to ask you it again, okay? Because the main reason somebody would do this is because they lose volume, right? Because when we lose volume through estrogen or the lack of, I can see why some women would do this.
No, and I'm not. I want to say it sounds like I'm being very judgmental. I just really don't. Like, I want to see the research. I want to see that this is like safe before I start putting it in 100%. There, right? Right.
No, I can say that I'm all for people doing it in a safe, obviously, manner. If it helps you, awesome. But I didn't even know it was a thing.
Neither did I.
I mean, I work in gynecology all day, every day, but I did not know this was a thing. So now I do. And when somebody is going to ask me about it, I'm going to say, hey, I don't do that, but I need to find somebody who does.
Okay.
Yes?
Yeah.
So I can refer
like
them.
Yes. Well, is there anything else, Jeanette? Because I have a slippery solution for you that
let's do it. Slippery solution. Still don't got it. We still don't got it.
That's okay. I heard today on a podcast that everybody can sing. They just have to be taught appropriately, and I'm gonna call bullshit on that. I will never be able to sing. Me too. So
no. Mm-mm.
This is kind of a long one, but this is a goodie.
Okay, I'm ready.
Dear B and J.
Okay, yes.
My boyfriend of 4 years, good for you, and I broke up briefly late last year. During that time, I had a wild night and hooked up with a woman for the first time.
Okay.
It was the best sex of my life. Recently, my boyfriend and I have reconciled. Okay. Unfortunately, now I am having to have sex that is mediocre at best. Should I tell my boyfriend about the girl and maybe he'd be inspired? Or should I continue to have boring sex?
Oh my God, this is deep on so many levels, right? Because this is, wow. So maybe this was her first experience with a woman? Maybe,
that's what she said. She said,
okay.
For the first time.
Okay. I think this is where you have an honest conversation with yourself first, right? Like, are we in a heterosexual relationship, but we're really wanting a homosexual relationship? Or are we in a heterosexual relationship and you're more of a bisexual person and you are interested in both? So I think needs to be an honest conversation that you have with yourself to try to figure this out, because the last thing you ever want to do is settle, whatever that means, right? The last thing I want you to do is stick around with this guy because that's what you think it's supposed to be like, or that's what everybody else thinks it's supposed to be like. And so you just stick with it. But if you're truly not happy and you had better sex with a female,
with a stranger,
it might be that you actually are more bisexual than heterosexual. Or on top of that, maybe you and your partner need to have a talk about, hey, look, this happened and I don't know why this happened and why I had these feelings afterwards, but we need to figure this out together, right? And it sounds like y'all have been together for a while. I mean, 4 years is a long time to get to know somebody. So if he's not open to that conversation, and A, if he judges you, or B, if he thinks odd or weird of you, then maybe it's not meant to be.
And I have a lot of questions. I was tempted to write this person back, except they did not leave a email address to write back. So yes. I couldn't ask any questions.
Yes.
So how old is this person? Right. So have you been with somebody for 4 years and this started in high school and like now you're in college? And I know you and I both personally know people that have been with somebody for their entire, well, I shouldn't say entire life, but their entire dating life.
Yeah.
Right. So it went from dating in middle school to still dating in college and then getting married. And that's the only person they've ever had any sort of physicality with. Right. So maybe, and we're hypothetically speaking, maybe this girl hasn't had a lot of experience. So all she knows is her boyfriend. And there's a level of comfort there, right? And then she meets this person and has this like amazing experience, but then goes back to her boyfriend because that's what's comfortable for her, right? That's what she's known for the past 4 years. But is she constantly going to be thinking like in the back of her mind, like what else is out there? Like I tried something for one day and it was wonderful and better than what homeboy's giving me. But that's not to say that maybe she has no attraction to women and that just was like a wild night, like she mentioned. But like maybe it's worth exploring potentially someone different than the person you've been with for 4 years. Like, are you
absolutely?
I guess. Sorry, I'm. This is snowballing, but I guess the main question is you need to like look at your relationship and potentially say, like, is this a comfort thing or is this really what I want?
Absolutely, 100%. And it's got to be an internal conversation first, and then you move to the partner.
And let's also be honest, good sex is important.
Yes. Because the rest of your life, you're going to think about that one night and never have it again? No, we're not doing that.
Well, yeah.
Not doing that.
God bless. I don't know. If this person's listening, I want more details. Please.
Right.
Please
can you send us some more information? Because now we are all the way emotionally invested.
We're very invested and
so are our listeners.
Yes. Yes. So again, we no judgment here at all. We want more information.
I do. And I want to know what happens.
Okay. Well, we'll let y'all know if we figure it out.
Okay.
All right.
Well, that was a good one. I hope everybody learned a little bit. And like we always say, if you have any other questions or maybe you have a specific supplement that we did not mention today, because obviously there's a billion of them and you want more information on it, send us a little message on the side and one of us will get back to you with what we recommend as far as dosing on that, or if we think you need it, or if we think, I don't know much about this, let me look into it a little bit for you. So we'd be happy to answer those questions for you.
What she said.
Yeah. Well, thank you, Brittany. This has been wonderful.
Yes, it has been wonderful. Can't wait to do it again. I know our next episode, we're shooting for some piggybacking off of the vitamin D, some bone health with a special guest. So get ready.
That'll be fun. All right.
All right. Talk at y'all later.
Bye, guys.
Bye.
The information provided in this podcast is for general informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts, guests, and producers of the podcast do not assume any liability for the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk.